Hi class, my name is Josie Nava. I'm here to present a pediatric tracheostomy tube change to nursing residents. We're going to begin, of course, by introducing the nursing resident, Isela.
Hi, Karen.
Very good. We're going to ensure the child and the family understand the procedure and that we have a doctor's order for the procedure. Next, we will wash our hands. And for demonstration purposes, we will make sure we have PPE, protective equipment. Isela, we will also show the emergency equipment needed for a tracheostomy tube change. A resuscitation bag, mask, appropriate size for the patient, suction equipment, with a suction catheter, appropriate size for the tracheostomy tube. Of course, we will also have the tracheostomy tube holder, and of course the tracheostomy tube itself, with lubricating KY, saline for suctioning, and a mask if we so desire to wear one. For this purpose, for the demonstration purpose, we will have a telemetry monitored patient. So they will have their heart rate, respiratory rate, and breath sounds, which we will assess. Oxygen saturation is monitored with a pulse oximeter. The nursing resident will assess the respiratory status of the patient.
Okay, sounds are clear bilaterally, satting 99%.
Very good. Next, we will position our patient with a shoulder roll underneath the shoulders. We will have, of course, the equipment and a blanket to maintain a mummy position or a papoose position. And then we will make sure that we will be ready to role play changing the tracheostomy tube. The first caregiver would move around and remove the trach ties as such, as the second caregiver would be lubricating the tracheostomy tube as such. And then of course the first caregiver, being me, would remove the trach tube as the second caregiver would come in, place the trach tube in, and remove the obturator, as the first caregiver would place the tracheostomy tube tie. Ready? Okay. Place that one in first. Okay, now I am the first caregiver. I will maintain a secure tracheostomy tube in place. Throughout the whole procedure, we will be monitoring respiratory rate, heart rate, oxygen saturation. A respiratory assessment will be made. So count of 3, I would remove the tracheostomy tube tie. Count of 1, 1,000, 2, 1,000, 3, 1,000. Out with the old and in with the new. Pull out the obturator. Place the new trach tie. And as she holds, the first tracheostomy tube holder would hold the trach tube in place, and the second one would say, "Got this," and place the trach ties. Place with one finger between the trach tie and the trach tube patient.
Okay, lungs are clear bilaterally, satting 100%.
Very good. Any questions, anybody?
I have a question.
Okay.
Is it necessary to hyperventilate the infant prior to exchanging the trachs?
Most definitely, if your respiratory rate, heart rate, oxygen saturation is not within normal limits appropriate for the patient, yes, most definitely, we would hyperoxygenate with a resuscitation bag attached to the tracheostomy tube, giving what we would assume rescue breaths and the respiratory rate and rhythm of the patient. Confirming that we have good oxygen saturation, and we would then proceed changing the tube. Any more questions?
Nope.
Thank you. Thank you all and have a good evening.